So what do we actually mean by menopause? Menopause means the ovaries, which normally produce hormones, have stopped producing these hormones. And if you remember this, everything about menopause makes sense. So this usually happens through aging, when ovaries would stop working and they stop making hormones, and this would mean you've gone through natural menopause. Other term that is closely associated with menopause is perimenopause. Perimenopause is time before menopause when our hormones start to decline. And this will be a phase when our hormones will usually fluctuate. So you may notice that your periods have changed, and you may notice that your moods have changed. And this happens because there'll be times where your hormone levels will be low, and then this may be followed by a period of a spike in your hormone levels. This period usually lasts a few years before menopause. Menopause is permanent stoppage of periods, and we usually consider 12 months of no periods to diagnose menopause, and perimenopause could be a number of years before this happens. Women with perimenopause and menopause often come and see me for a variety of symptoms. The common ones are hot flushes, difficulty sleeping, lack of concentration, brain fog, mood fluctuations, and lack of libido. But the list of symptoms associated with menopause and perimenopause is endless. So this could be anything from increased palpitations, dry eyes, dry skin, itchy skin, restless leg, tinnitus, feeling dizzy, and anything and everything you can think of can be associated with menopause. So my first advice with regards to any of these new symptoms would be to have an overall health checkup with your GP before we decide that all your symptoms are down to menopause. One of the first things I do with regards to menopause is to talk to women about menopause, because I think it's extremely important that if you understand the changes your body is going through, you will be able to look after yourselves better.